Have you ever pondered about what causes pneumonia and how it's treated? Welcome, as we delve into the world of pneumonia, a significant infectious respiratory disease that can pose severe health risks. Pneumonia is a condition that affects lung tissue caused by a variety of microorganisms, including bacteria, viruses, and fungi. The primary types we encounter include bacterial pneumonia, viral pneumonia, and fungal pneumonia. Symptoms can range from fever and coughing to shortness of breath, chest pain, fatigue, and chills. Factors like age, smoking habits, immune system strength, chronic conditions, and vaccination history can all influence the risk of contracting it. Treatment strategies vary depending on the type of pneumonia and can involve antibiotics, antifungal medications, fever reducers, pain relief, and recommendations for rest and hydration. Now that you know what pneumonia is, let's dive into what causes it. Pneumonia is not caused by one single factor, but a variety of microorganisms. Let's delve into this a bit more. The three most common types of pneumonia are bacterial, viral, and fungal, each caused by different types of microorganisms. Bacterial pneumonia, the most common type, is primarily caused by a bacterium known as Streptococcus pneumoniae. This bacterium can live in your nose or throat without causing harm, but when your immune system is compromised, it can invade your lungs and cause pneumonia. Viral pneumonia, on the other hand, is mostly due to influenza viruses or respiratory syncytial virus, commonly known as RSV. These viruses spread through the air and can infect the lungs, leading to inflammation and pneumonia. Lastly, we have fungal pneumonia, which is typically seen in people with weakened immune systems or those who inhale large amounts of fungi. This could be from soil or bird droppings, particularly in certain geographic areas. It's essential to remember that these microorganisms can cause pneumonia in different ways. Bacteria and viruses usually invade the lungs, while fungi can be inhaled. Each type of pneumonia also has different treatments, so correctly identifying the cause is crucial. Understanding the causes of pneumonia is crucial, but recognizing the symptoms is equally important. Stay tuned as we explore the symptoms of pneumonia in our next segment. Pneumonia often comes with a set of symptoms that should not be ignored. This respiratory illness presents itself with a variety of signs that may differ depending on the individual's age and the state of their immune system. Commonly, one of the first signals of pneumonia is a persistent cough, often accompanied by purulent or bloody sputum. This is due to the infection causing inflammation in the lungs, leading to an increase in mucus production. Individuals may also experience a high fever, which is the body's response to fighting off the infection. Shortness of breath is another prevalent symptom, as pneumonia affects the individual's capacity to take deep and full breaths. This can be accompanied by chest pain, particularly during coughing or breathing deeply. Further symptoms can include fatigue and chills, as the body diverts resources to combat the infection. In older individuals, or those with weakened immune systems, symptoms may be less obvious or take longer to develop. They might experience mild confusion or a lower than normal body temperature instead of a fever. It's crucial to remember that pneumonia can be severe, especially in these vulnerable populations. While these symptoms may be alarming, there are treatments available to combat pneumonia. Recognizing these symptoms early and seeking medical attention is key to a successful recovery. So listen to your body and don't hesitate to seek help if you're feeling unwell. Treatment for pneumonia depends on the type and severity of the disease. Let's delve into the different treatments for bacterial, viral, and fungal pneumonia. Bacterial pneumonia, the most common form, is typically treated with antibiotics. The specific antibiotic prescribed depends on the type of bacteria causing the infection and the patient's overall health status. In most cases, patients start to feel better within 2 to 3 days of starting antibiotics. Viral pneumonia, on the other hand, doesn't respond to antibiotics. Instead, treatment focuses on easing symptoms and supporting the body as it fights off the virus. This might include over-the-counter medicine to reduce fever and pain, plenty of rest, and staying hydrated. In some severe cases, antiviral medication may be used. Fungal pneumonia is less common and is typically seen in people with weakened immune systems. Antifungal medication is used to treat this type of pneumonia. The treatment duration varies based on the type of fungus causing the infection and the patient's overall health. But irrespective of the type of pneumonia, some general advice holds true. Rest is crucial. The body needs energy to fight off the infection and recover, so taking it easy is not just okay, it's necessary. Hydration is another key aspect of treatment. Drinking plenty of fluids helps thin out the mucus in the lungs, making it easier to cough up. This can help clear the infection faster. It's also important to note that even after you start feeling better, it's crucial to complete the full course of medication prescribed by your doctor. Stopping treatment early can lead to a relapse or a harder to treat infection. Lastly, don't forget to follow up with your healthcare provider. They'll want to ensure the infection is clearing up and that there are no lingering complications. Remember, early diagnosis and treatment are key to recovery. So, if you or someone you know is experiencing symptoms that could be pneumonia, don't hesitate to seek medical attention. Your health is worth it. So, we've covered a lot about pneumonia today. Let's recap the key points. Pneumonia is an infectious disease that infiltrates the lungs, primarily caused by bacteria, viruses, or fungi, with various types including bacterial, viral, and fungal pneumonia. Symptoms can range from fever, cough with purulent or bloody sputum, shortness of breath, chest pain, to fatigue and chills. These can be less apparent in older patients or those with compromised immune systems. Risk factors can vary, with age, smoking, a weakened immune system, chronic conditions like diabetes or asthma, and lack of vaccinations playing significant roles. Treatment typically involves antibiotics for bacterial pneumonia, symptomatic treatment for viral pneumonia, and antifungal medications for fungal pneumonia. Additional remedies may include medications to reduce fever and pain, rest and hydration. Stay informed, stay healthy, and continue to expand your knowledge about such important health issues.